Garlic has been used for thousands of years for both food and medicine. It's one of those simple ingredients that's easy to overlook, but surprisingly powerful when it comes to supporting your health, especially when you're trying to eliminate toxins from your body. In this video, I want to talk about how to use it correctly for detoxification, and we will also discuss raw, cooked, and supplemental forms of garlic. And then we will talk about possible side effects and the ideal dosage. Let's get into it. Okay, first things first, garlic is a bulb that belongs to the allium family, so the same family as onions, leeks, and shallots. What makes it special is its sulfur-based compounds, especially one called allicin. Allicin is created when garlic is crushed or chewed, and it's responsible for that strong smell. It also contains secondary compounds, usually sulfur-containing ones, that also contribute to its health effects. Which brings me to the biochemistry behind garlic being a detox food. One of the main ways it supports detoxification is by boosting the body's natural detox enzymes, especially in the liver. The sulfur compounds in garlic help increase the activity of phase 2 liver enzymes, which are responsible for binding toxins and preparing them to be safely excreted. That means garlic helps your body break down and eliminate harmful chemicals, heavy metals, and other waste products. Also, it's known for being antimicrobial, so it can help kill off harmful bacteria, viruses, and even some parasites in the gut. Obviously, this will improve your gut health and reduce the load of unwanted microbes that your body has to deal with. Some people even use garlic as part of a parasite cleanse, but then it's usually taken together with things like papaya seeds. On top of that, garlic can be a good addition if you're targeting heavy metal detox, especially in the case of lead and mercury. Some studies have shown that it can help reduce the buildup of lead in tissue and protect against the oxidative stress that is caused by these toxic metals. It doesn't act like a chelator, so it doesn't bind and pull metals out like alpha-lipoic acid, for example, but instead it supports the liver and your antioxidative system, which both reduce the damage that these toxins can do. Lastly, garlic also contains small amounts of selenium, which can also bind to toxic metals. So combined with its high sulfur content, garlic becomes a natural supporter of glutathione production, which relies heavily on selenium and sulfur to work. Of course, it isn't for everyone, and there can be side effects, especially if you take too much at once. For example, eating raw garlic can lead to things like stomach upset, heartburn, or bloating. And as you know, it's pretty strong, and on an empty stomach, it will be irritating. You can obviously get bad breath from it, and if you take too much and for a long time, then your body odor can also change. On top of that, garlic can thin your blood, so if you're on blood thinners or have a bleeding disorder, you should definitely check with your doctor before using it in large amounts. And then there are people who are allergic to garlic. You will notice this in symptoms like skin rashes, itching, or headaches, and it's usually a sign that your immune system is reacting to it. Now let's talk about when and how to take garlic if you want to support overall detoxification. Raw garlic will be the most potent form, especially when you crush it fresh. To get the most allicin, so the active compound, it's best to crush the garlic and let it sit for 10 to 15 minutes before then eating it. This gives the enzymes in it time to activate and form the allicin. You can then swallow it raw, mix it into salad dressings, or spread it on bread with some olive oil. Start with half a clove to 1 clove per day, and then build up slowly to see if your stomach can handle it. Obviously, if you mix raw garlic with other foods, then this will also help reduce stomach problems. Now, I should say that cooked garlic still has some benefits, but much of the allicin will be destroyed by the heat. But cooking enhances some other sulfur compounds, like diallyl disulfide, which also support liver function. So cooked garlic is still helpful and better than nothing. If you don't like the taste or smell of garlic, or your stomach can't handle it raw, you can also try garlic supplements. These come in capsules, tablets, or oils. The most popular form is aged garlic extract, which has a gentler effect on the stomach and still gives you a lot of antioxidant and immune support. Here, a normal supplement dose ranges from around 300 to 1000 milligrams per day. Garlic oil capsules can also be used, but they usually contain less active allicin. So definitely look for ones that are standardized for allicin content to make sure you're getting the real thing. And you probably also want to look for supplements that are odor-controlled, enteric-coated, or labeled as stomach-friendly. One last thing, garlic can be taken daily as part of a long-term health and detox routine, but some people like to cycle it. For example, 2 to 3 weeks on and 1 week off. You can also combine it with other nutrients like milk thistle or N-acetylcysteine to build your detox stack. All in all, garlic is a pretty powerful natural detox food, and it supports liver function, fights off microbes, and helps the body handle toxins better. I would first try eating it raw or adding it to your cooking routine, and only then take supplements if you don't tolerate it in any other way. Just go slow, listen to your body, and keep an eye out for any side effects.